Well, Dr. Wan Wang, I'd like to talk to you about something, TMJ. Personally, I do not know how to pronounce the full word, and if you could do that for me, that would be nice, what it stands for, what the long word is.
TMJ stands for temporal mandibular joint.
And that's this joint here?
Yep, right where we chew. That's the hinge where our jaws open and close.
Yeah, the hinges. And apparently those hinges are literally the most complicated hinges in the body. Is that correct? And tell me why if it is so.
Yeah, it is correct. It is one of the more complicated joints. A lot of people have a lot of problems with it.
I have a hard time understanding you. Could you please speak up, Dr. Wang?
Sure.
Okay.
Is this better?
Yes, this is better.
Okay. So the TMJ is one of the more complicated joints in our body because we use it every day to talk and chew our foods. And if there's any kind of diseases or problems with it, we kind of it'll be associated with a lot of problems that can lead to like headaches, muscle aches, and also leads to our inability to talk comfortably and to eat.
Shoulder pain, neck pain, kind of like moving the head, apparently it kind of like can affect that whole upper area quite drastically. Now, what are some of the reasons why one might get a jaw problem, doctor?
There's many reasons for it, but one of the main reasons is our teeth are not aligned, and a lot of it has to do with bruxing. So during the night, if we have a patient that's a bruxer that grinds constantly, that kind of irritates the joint and makes it ache really bad when they wake up.
Mm-hmm. So the teeth not aligned, a little bit like a cogwheel where it isn't quite aligned, and or maybe a cogwheel is missing, which I do think you at one point mentioned that missing teeth, one or two, that then the teeth start shifting themselves all the way to the front if it's in a big shifting, not necessarily, but could be. Either way they start shifting. So is that a reason why then the teeth might not be aligned, which then in turn makes the jaw out of alignment?
Yeah, that could be one of the reasons. Just a small shift in the teeth can cause TMJ problems. Because when we go and chew and grind our teeth at night, what happens is if the teeth aren't aligned, then the TMJ gets offline as well, and then it kind of irritates the muscles and the ligaments that hold up that joint.
Got it. Okay, so obviously, again, keeping all your teeth in it, but teeth could be in it in some crooked form, not fitting together up, down, or sideways, and by doing so, just naturally, without having any missing teeth as well, right?
That's right. Mostly it just causes an unbalance throughout the whole body.
Right.
Not only in the joint, but in our neck, in our muscles and spine. It could lead to a lot of problems.
Right. Well, I mean, if you really look at it, it's quite amazing how we have lots of important parts in the head. There's the brain, there's the eyes, there's the nose, the ears. It's all very, very important. So what makes us thinking that the mouth is not any less important? And yes, it affects all the way down, just like the feet. If you have crooked feet, you start having knee problem, hip problem, back pain problem, shoulder problem, headaches. So, and all that is connected to the spine. So I can see that this goes from up all the way down also if it is not aligned. So let me ask you, what are some of the basic methods to fix this problem?
Well, I think the first step is to attempt to use a night guard. So we would make the patient a night guard, which is an appliance that fits over their teeth so that when they're grinding their teeth at night, it doesn't damage their joints. And this fixes, I'd say, 75% of the patients.
Okay. Okay, wonderful. And what other methods are there if that doesn't work? Those other 20-25%, what are the recommended, options there?
There's other recommended options. We send them to see specialists like an oral surgeon to have the joint looked at. And we also send them to see chiropractors to have their spine adjusted or their neck adjusted or maybe just a simple massage. Those kind of things help a lot. I see.
So I see. So basically the teeth needs to get adjusted. Usually that works, but sometimes there may be surrounding things out of alignment already a little more that they also need to be adjusted or something like that. So basically, getting rid of those, because having a headache, for instance, because you have your teeth out of alignment, or because of anything, maybe one of your foot is longer or shorter or whatever it may bring, the headache, it's a very life-consuming thing, it's constantly, you're not working so well, you're not so good with your kids, with your family, you're just grouchy, you probably don't go to social functions and business functions as often as you otherwise would maybe like to. And yet the treatment is not really chemical, like aspirin, and it's not really very invasive, no major surgery involved. It sounds to me relatively simple.
That's right. The majority of TMJ problems can be solved by a very simple appliance. And it's very important that if you're having any kind of TMJ problems to come in, to have us take a look at it, and have us make you a night guard. That can potentially solve the majority of the problems.
Right. Now let me ask you, since dentists are so heavy involved in it, I've however noticed that not necessarily all dentists really deal with that. They might know about it and they can pronounce the word a lot better than I, but they're not really dealing with it. And there's really no TMJ doctor like a diploma as such in itself either, like there is maybe a endodontist for root canal or there's maybe a periodontist for gum disease where they really heavy specialize in it and then get a diploma on it. It doesn't look like that is really going on with TMJ. So is this a particular, because I know you're doing it, but not everybody. What are you guys getting trained for that very specifically to a degree?
We are. There is definitely a session in dental school that trains dentists about TMJ problems. There is no specialist. There's no specialist training towards TMJ functions because that's just a small part of what we do.
So it looks like it's a little bit like some doctors, some dentists concentrate and are interested more in, let's say, cosmetic, beautiful. Other ones a little bit more interested in, pulling teeth, or a little bit more interested in children, but not necessarily as such being specialized in it. And some people, some doctors, some dentists pay more attention to gum disease than other ones, and some pay more and say, headache, that probably has something to do with the teeth, and then they do it because they're interested in it. They're more holistic orientated than maybe some others. So it's a personal preference if a doctor gets interested. So if a patient has headache, and he has tried a few things, chiropractor and, aspirin, and it kind of all helped a little bit maybe, but not really, would it be a wise thing for him to go and say, I go and see a dentist who is interested and knowledgeable about TMJ? Would that be a good thing for him?
Can you ask that question again?
If a person has a headache for a while and he has tried certain things, he has tried a chiropractor, he has tried taking aspirin, he has gone to a physician, and overall it doesn't really work. Maybe it gets a little better here and there. Would it be a good thing for him to say, I go and look for a dentist and ask him whether he's well trained in DMJ, is interested in it, and then go and get that examination and see whether it is a DMJ, or at least eliminate it from the list of no, or like, hey, it is. Would it be a good thing for him to do?
Yeah, definitely it would be a good thing. If he's already tried his physician, the next step would be to come see a dentist, to have his teeth checked and to have his TMJ checked. And most likely, we'd end up making him a night guard to see if that works. And if that doesn't work, then we continue him down the road to other specialists.
Okay. And you have a pretty good idea when you examine him whether it could be the teeth which are misaligned and the jaw which isn't working, right?
Right.
Good. Well, wonderful. Thanks for your candid approach here. I'm sure there's lots of headache sufferers out there who maybe listen to this and may go, that is one thing I haven't tried yet. Bye-bye, Dr. Wang.